Yeah, it was really, really good. I really, really enjoyed it. It was really nice having a mixture of non-medics and medics on the course, which is obviously we haven't had before, because doing medicine I've only been sort of with medics on the course, being taught by medics, and now being in final years living with medics. So it was quite nice having a different sort of input into that, which is a lot different from other places which tend to be all medics on the course. And then as well as that, it's really, really well supported. My master's was in the medical school, so it was all kind of very familiar, and it was all just really, really well supported and just really fun. So the teaching that we had was sort of for the first half of the year, and it was really, really good. So it was a lot of lectures, but also a lot of seminars, and we had to sort of go away and do a lot of independent learning, which was very different to medicine. And it was quite good because I felt like you got a lot more time to sort of learn about a bigger topic, and you sort of got taught principles along with specific examples that you could then go away and translate to different things. So you got a lot more teaching about a subject rather than in medicine, which tends to be sort of one lecture on one topic and then you don't really see it again. So that was quite nice. And again, the teaching was really, really well supported. And I feel like Sheffield's really, really good at research. So we had a lot of sort of top experts in the research field teaching us about what they do. So it was really nice coming from someone who really, really knew what they were talking about and could explain things and answer questions really well. But I really enjoyed the teaching. Yeah, I really enjoyed my research project actually. I personally didn't do a lab-based project. I did a clinical project. So I was using online systems, NHS databases, to look at patient information and a lot of patient records to then sort of put it all together and get some results out of it. So I really, really enjoyed that because it's something that I've never had the opportunity to do before. And it was actually really nice that it was 6 months, because that was enough time to sort of really get stuck into it, know what we were doing, and feel like we actually made a lot of a contribution to what we were doing. And it was nice to then, at the end of it, pull out some quite significant results and know that that will have an impact on clinical care. I really, really enjoyed just getting a different approach to what I was doing. So because there was a lot of non-medics and a lot of the specialists that we were taught by weren't medics themselves, they were more researchers. It was really nice seeing things from a different point of view. So it wasn't all about medicine and that kind of thing. It was more the background behind it, going into way more detail about things that normally we wouldn't be taught about. Knowing how drugs are made, all the research behind it, all the clinical trials that go on. So it was really, really nice knowing about that and all the really, really hard work that actually goes into making drugs, researching diseases before we see it clinically, which is all that we really see in medicine. So it was a really nice sort of breath of fresh air, and it was really nice seeing that. And now I feel like when I go back into medicine, I can appreciate a lot of things a lot more. So I can appreciate how things are made and all of the hard work that goes into what we actually use clinically. Yeah, I definitely recommend that people do a master's. It was one of the best things that I've chosen to do at university, and it's really made me a lot more of a confident and more academic person, really.